Hi, I'm Dr. Todd Shatkin, and welcome to this Monday Morning Minute. Today I want to talk to you about how to handle medically compromised patients. You may be concerned about doing mini implants or any kind of implants on patients who are on steroids, who have diabetes, who are on a whole host of medications, or maybe they're on blood thinners, things like that. It's very important to know your patient, to understand what's going on with that patient. Are they on different medications? What do the medications do for them? And how could that affect the outcome of your procedure? And one of the things that's great about the mini dental implants is it's a very minimally invasive procedure. You see, the term mini, although we always think of it as a size, in my mind, and what I try to portray to our patients is mini doesn't just mean size, it means it's minimally invasive. There's minimal time involved to have the procedure done, minimal office visits, minimal pain, and minimal cost. So mini can connotate a number of different things. In the context of the surgical procedure, it's a minimally invasive procedure. And because of that, people who take certain medications can still have this procedure done. You see, steroids, for example, they interfere with the autoimmune system. They make you immune suppressed, and that's how they work. But at the same time, they cause people to heal at a slower rate. But the great thing about mini implants is you're not relying on the body's ability to heal very much. With a conventional implant, you have to make a flap, you make osteotomies in the bone, you traumatize the bone, and then you rely on the body's ability to heal. With the mini implants, we don't do any of that. So mini implants heal much more rapidly. So patients who are on steroids, patients who take certain medications, patients that are diabetic, they can all have the mini implant procedure performed very efficiently and very safely, and they will still heal very normally. So you don't really have to worry about your patients who are on steroids for mini implants. Now let's talk about blood thinners, for example. There's an awful lot of different blood thinners out there, and you need to learn which ones are out there because they change all the time. But for example, let's talk about warfarin or somebody who's on Coumadin, that's a warfarin product, or Plavix, for example, or even just baby aspirin. Those are all types of blood thinners. And you'll ask your patient, are you taking a blood thinner? They'll say no, and you'll later find out that they take baby aspirin every day. Well, they are on blood thinners because baby aspirin is a blood thinner, and it will cause an increase in bleeding. Now, if you're extracting teeth, or you're making a flap, or you're doing invasive surgery, you've got to talk to the patient's physician about the possibility of reducing the amount of blood thinners or cutting it out for 4 or 5 days prior to surgery and a couple days after. But if you're doing just straightforward mini implants without any surgery, you're making a little tiny pilot hole in the gum, you thread the implants in for like a denture stabilization, you don't need to worry about the blood thinners. You can do the procedure as soon as that implant goes in the bone, and it will stop any bleeding. So yeah, when you make your pilot hole, you might get a little bleeding. As soon as you plug it up with the implant, the bleeding stops. So don't be concerned about blood thinners with non-surgical mini implant procedures. If you're doing surgery, you need to be cautious and talk to the doctor and see if and when you can stop those blood thinners. So the bottom line is, mini implants are much less invasive, much less of a procedure than conventional implants, and in 95% of the time, the patient can continue to take the medications they're on. There's very little risk of any problem with patients who have diabetes or taking steroids or blood thinners with mini implants, unless you're doing a more invasive procedure. I hope this helps you understand the medical compromised patient, and we're always here to answer your questions if you have a specific patient that you want to talk about. It's good to be here, and I'll see you on the next Monday Morning Minute.
Good morning and welcome to the Monday Morning Minute. I'd like to tell everyone that we're having an advanced World Symposium on mini dental implants on June 3rd and June 4th. Dr. Shatkin and doctors from the International Academy of Mini Dental Implants will be speaking at this facility on June 3rd and 4th. It should be absolutely awesome. Dr. Shatkin's going to be doing live surgery on Friday the 4th. If you wanted to be chairside with Dr. Shatkin, this is the place to come. And Dr. Shatkin's brother, Samuel Shatkin, will be offering a Botox and fillers course which is completely optional, but it's offered on Saturday, June 5th from 8 a.m. to 3 p.m. And if you need more information, you can call us at Checkin' First and we'll give you all the details. And keep in mind, on August 6th and 7th, we'll be down at Walt Disney World in Orlando, Florida for our summer mini dental implant educational seminar. And if you have a family and you want to come down, now's the time to do it. You can save money and come down and see a great Checkin' First mini dental implant course. And don't forget, our International Academy of Mini Dental Implants meeting this year is going to be held in Nashville, Tennessee on September 24th and September 25th. We would love to see you there. We also have our specials going. You buy 4, you get 1 free. So if you buy 4 boxes of Osteogen, you get 1 box free and you can mix and match whatever you need. Strips, slim plugs, large plugs, whatever it is, we got them for you. We have the Piezotome Cube that was going over very well last week at our course, as well as the IntraSpin and the implants. If you haven't tried the mono dental implants yet, please give them a shot. These things are incredible. We can bend them, we can make it fit into place, we can align it. It is a great implant. So please take a look at our website at checkinfirst.com and come visit us here in Buffalo or out on the road for one of our mini dental implant lectures. I guarantee it'll change the way you practice dentistry. And we look forward to seeing you on next Monday's Monday Morning Minute. Have a great week placing mini implants.